Hello and welcome back to Center Webcast. Today is Thursday, April 28th. It's about 6 p.m. My name is Gerald Smith. I am joined today, as usual, by Dr. Sybil Moore, our co-host. Today's guests are Mark Richards, the Chief Growth Officer for the Indiana Regional Medical Center, and also Amy Kemp, the Executive Director of the Indiana County Community Action Plan, ICAP. As usual, I'm joined with Zoom and Facebook production, Dr. Brandon Vick. The Center for Community Growth's mission is to lead individuals and organizations in and around Indiana County advancing social, racial, gender, LGBTQIA, economic, and environmental justice. The COVID-19 Indiana County Webcast is a regular broadcast designed to keep you informed during this COVID-19 pandemic. Our guests have included elected and appointed community leaders, folks in nonprofits in the service industry, small business owners, and local heroes doing incredible work in the community to make sure no one falls through the cracks. Don't miss our huge bank of interviews from Senator Casey to small business owners to folks pumping out masks and face shields from here to California. They're all available on our YouTube channel, so please subscribe. We hope this remotely produced broadcast will help you understand how this pandemic is impacting you and the Indiana community. We're coming at you Sundays at 2 and Tuesdays and Thursdays at 6 p.m. And each episode, like I said, is available there on our YouTube channel. Please subscribe. I'm going to move right on to our first segment today. I'm excited to be joined once again by folks from IRMC, Indiana County's biggest medical facility. Joined today by Mark Richards, the Chief Growth Officer. How are you doing, Mark?
Doing well, Gerald. Thanks for having me. Appreciate it.
Great. Sure. Thank you for thanks for being with us again today. So I'm wondering if we can go right into it, thinking about the COVID-19 pandemic here in Indiana. Can you give us an update on where we are in terms of numbers here in the county with respect to cases and testing? And in particular, I wonder if you could characterize a little bit who has been impacted most. We, at least looking at the data available from the state, looks like the deaths that have occurred here have been in nursing homes. So I'm wondering if you can talk a little bit about how IRMC is helping out our regional other care facilities outside of the hospital.
Yeah, Gerald, I'd start by saying that, I feel very blessed that we are in Indiana County. I think that it's been interesting to see as you watch what's going on across the state and places where there's a lot of activity, and then you think about where we are here in Indiana County. And I think if you want to, compare and contrast, over 42,000 positives in the state of Pennsylvania right now. And we've in Indiana County seen, I think our last count was 63. So, you can do the math. I mean, we've honestly been very fortunate as far as that goes. What was your other question, Gerald? Help me here.
That was the first question. I think we have kind of leveled off. I think that's right. Can you characterize who's being impacted by it? The folks who are coming in, who are testing positive?
Yeah, I don't know that there's. I have a generalization for that. I think it's been mostly, the older population, the older demographic. As you said, the deaths were from a nursing, facility. And I think that that's common. I don't think that's uncommon for, any area. And again, we have been fortunate that the numbers have been so low.
I think that's right. We've been looking at the numbers. This is I guess a speculation I'm kind of asking, but we've been talking since we started this broadcast about flattening the curve and thinking about social distancing measures. And when we look at cases here in Indiana County, like you said, we're at about 63. I think that's the same over the last couple of days. Are you folks there at IRMC thinking that we have seen the peak, that we are possibly seeing the peak here locally?
I mean, I'm not an epidemiologist, and I'm not going to portray one on the internet here, but I think that we can have some confidence that maybe we have. I definitely would say that what we've done as far as the social distancing and all the measures that everyone's taken their own responsibility for it, it's definitely had an impact. I think that's clear for us. So we haven't seen the community spread that some other counties have seen. And so, the things that folks are doing have been working. So as far as saying, have we beaten it or flattened the curve, I don't want to get out ahead of ourselves, but I think there is some, at least some statistical data that might support that. Now, that being said, we continue to prepare as though, things could change tomorrow, they could change Thursday, and we could be, right in the heat of things. We're not sitting back and taking it for granted. Oh, it's been 3 days in a row without a new case, yada, yada. I mean, that's not the case. But I think if you want to sit back and maybe take an objective look at it, I mean, you could, start to feel good as a resident of the county that things are improving for us.
Yeah, I think I think that there's been some positive news there. One of the things we've been following a lot here is also about testing. And I think when Mr. Wolf was here a couple weeks ago from IRMC, he was talking about wanting to ramp up the levels of testing, wanting to ramp up the amount of testing. So I guess my question is, how are we doing on testing folks here in Indiana County? What we're hearing a lot about is that reopening, being able to reopen safely, quote unquote, reopen our economy safely, open these things up that have been closed, really depends on having a real big testing bank. And so I guess my question is, how are we doing on testing? How soon could we be in a position to say test all of our residents or all of them that really makes sense here in the county?
Yeah, that's a tough one to put your finger on, Gerald. So, I mean, we have increased our testing and our testing capacity. One of the things that I think you've heard about was our partnership with IUP to be able to do some of the results in-house, which makes a big difference. We'll be able to get some results back within 4 to 5 hours, where it was taking 3 to 4 days when we send them out. So that's going to be a significant advantage for us. That whether someone's has to wait 3 days to hear whether or not I'm positive, or is laying in a bed in isolation, not knowing if they're positive, which takes up time and resources and PPE and everything that goes along with it. So that's going to be a big advantage for us and for the county. I don't know that we're anywhere near just saying, hey, 89,000 Indiana, roll on up and we'll get you taken care of. Testing supplies continue to be an issue nationwide. It's not just Indiana County, our ability to get them. So we're working on some things that we think may help us. We've started to do some more testing because we have gotten more kits and more reagents, swabs, those kind of things that we need to do the testing. So that has come through. So I would say over the past 2 weeks, our testing has increased, but we're nowhere near the point where we're ready to just, make sure we can clear everybody in the county. As much as we would all like to do that, we're just not there yet. It's not possible.
Do you have a sense? So the collaboration between IRMC and IUP, the news release was talking about up to 200 tests a day. Do you have how close are we to that?
Well, let me clarify that. That means we have the capacity to do results for 200 tests a day. So, I mean, if we had 200 kits, we could do that, every day. But that has more to do with the testing capacity than the actual test itself, which it still matters. It's still going to be a big advantage for us, as far as taking care of folks and getting results back.
So it's really a question of supplies for the testing side, not necessarily the analysis side, is what I'm hearing. Great.
That's right.
So I'm going to shift a little bit and thinking a little bit about IRMC and in terms of how the hospital is handling the pandemic and the ramp up and the draw on supplies. How is this impacting finances of IRMC? We read a little bit about rural hospitals being stressed financially. And my understanding is a lot of the services that would have been happening normally were canceled or postponed based on pandemic. How is this impacting the hospital? And are you expecting any kind of relief from either the state or the federal government for the pandemic?
Yeah, well, I mean, it's not been a positive. I can tell you that, Gerald. I mean, when you close elective procedures and you close outpatient testing and you tell folks, stay home, I think we're even seeing that people aren't coming to the ER as frequently as we have seen in the past. So financially, it's been a burden, but our mission is to take care of the community, and we're going to do that in whatever way that we have to. Um, we still have inpatients that are, safely on other floors and those kind of things. And so, some things that are still urgent, have been taken care of. And the good news is we have figured out how to do that properly with the correct personal protective equipment and procedures and processes within the building once folks get there. So, I mean, that's a positive because we're going to start to have to talk about electives being opened up by the governor. And that's, certainly whether that was an economic move by him or just realizing that folks are delaying care right now, which is also very dangerous. And I get that folks, whether you're off work, or unemployed or maybe lost benefits during all this. So, there's a lot of factors that go into this. And we're going to weather the storm. We've been around. It'll be 106 years this year. We'll get through this. And the hope is somewhere along the line, there'll be something from the Fed or the state. But, at IRMC, we've been independent hospital for 105 plus years. And we're not going to sit around and wait for those dollars to come in. I mean, we have to figure out how to run a hospital and take care of the community. So I'm confident that we'll get that done.
Great. We've had I guess Senator Casey on recently and was talking about possible relief for state and federal relief in terms of money for local hospitals. Is that something you guys are going after?
Yeah, we're looking into that constantly. I mean, we have regular calls with Harrisburg. We follow the news just like everybody else as far as the Fed goes. There hasn't been anything clearly defined yet. I think that's still kind of up in the air, which is really unfortunate. And it, of course, becomes a bipartisan, part. I mean, we all understand what's going on.
It becomes political pretty quickly, right?
Very quickly, but we know there's money there. We do feel like there'll be an opportunity, and hopefully that we'll be in the right place to take advantage of that.
Cool. So let me switch a little bit. You mentioned this about elective surgeries, and I believe there are recently released guidelines from the Secretary of Health outlining recommendations to begin elective surgeries again. Do you have a timeline on that? And what does that process look like for you to sort of reopen those things?
Yeah, there's no timeline as of today. I think that order, that just came out Monday, I believe.
I think that was just Monday. Yeah.
Yeah. So, I mean, we've been meeting about that. I mean, for a week or so now, because we knew at some point this was going to occur. Nobody knew when. But, we've been working on the eventuality. And so a lot of that just has to do with the processes that we put in place. Once folks either get cleared for surgery, through an outpatient testing or through their primary care physician, through their specialist, I think that the biggest piece for us is being able to manage patients safely within the building. And I'm confident that we're there. Now, we don't have a date. And this isn't something that's just going to open like a spigot either. So, we're going to have to look at a lot of factors, who's in most need, and do things appropriately from a standpoint of care.
How about, so you mentioned PPEs a little bit, and that's something else we've been following a lot here is the availability of PPE. We've had a couple folks on who've been, some of these mask making champions, the cloth masks, not necessarily the medical masks, but then also had the COVID Avengers, Brad Adams from down there in Homer City, who has made just an astounding number of face shields. I saw a really interesting post on his Facebook. There was a post saying, I need 30 face shields. I'm in California. And Brad replies 5 minutes later, just give me an address and I'll send them to you, which is just amazing. How is IRMC doing on supplies? I know there hasn't been necessarily a surge in patients like we've seen in other places, so there may not have been a stress. Are there critical needs? What are those critical needs, and what can the community be doing to help you out with those?
Yeah, right now I'd say, Gerald, that we're in a pretty good position. I think that a lot of people work very hard to find supplies within our organization. There's been a lot of effort internally, and then the external stuff, the community giving back has been. I can't. At some point, we'll sit down and go through and kind of tally up, but the numbers have been crazy. The cloth masks, what people have been making for us. We had some folks that are trying to make gowns um, from bedding material. I mean, just so creative. It's really been uplifting through part of this. But as far as we're concerned right now, from a PPE standpoint, I think we're in a good place. Again, that could change tomorrow with some kind of surge. But I think we continue to, again, not to rest on our laurels, but I think as of today, we're in a pretty good place as far as that goes.
That's great. That's great. And folks can still contact the hospital. They've got something they can donate, but they're in good shape, as it sounds.
Absolutely. Yeah, absolutely.
Great. So the other thing I guess I wanted to ask about is about this process of reopening. We, assuming we have reached some kind of a peak, or we're not going to be seeing cases, at least regionally, really have much of an exponential growth. Assuming we continue the social distancing practices, what are your thoughts on reopening, and how do we avoid the kind of double hump sorts of graphs that we've seen predicted and have seen happen in previous pandemics? We saw this one from 1918, right? Things started reopening and we saw a jump there again. What's your thoughts on this reopening, and how do we make sure we can continue what I guess we call the progress, or the positive results, the relatively positive results that we've had recently?
Yeah, I mean, I think it's still going to come back to us and how responsible we can be as grown-ups in 2020, and really to continue to follow some of these things. We're all itching to get back with our friends and maybe hang out and go get pizza and all those kind of things. But it's not going to happen. This isn't going to be a flip of the switch for the reopen, and we're going to have to continue to just do the basics. It's wash your hands and all those things that go along with it. I don't know that there's going to be any quick recovery that we'll say, okay, next Tuesday let's go and be ready to go. I think one of the great things, especially from a hospital perspective, is that we're prepared for whatever comes. I mean, that's what's been really fascinating through all this for me as a non-clinical person and part of the hospital, is it's just how prepared we've been. And in truth, I still go to work every day, and my office is in the medical arts building where the cancer center is, and I get screened before I'm allowed into the building, and so my temperature is taken. And so we've put a lot of pieces in place that are, it really, at the end of the day, the hospital is probably one of the safer places, in the county as far as that goes. We're screening folks before they come in. Starting tomorrow, everyone will have a mask. If you have to come in, we'll be providing the masks for all patients and visitors. And so, as we get towards the kind of opening up, and more of the elective things, it's good to see that, we're ready, from that standpoint, from a healthcare provider.
Cool. So I just have two more questions. One is sort of maybe it's a quick one. You've seen some of these folks who have decided to not follow so many social distancing guidelines and have these rallies in a variety of places. And I'm wondering if you could go on the record and tell us, what do you think about these rallies? Are these a good idea? How do the folks at the hospital feel about this idea that people would want to come together, ignore social distancing guidelines right now?
I mean, if you're going to listen to science, and it's probably not the greatest idea in the world. I mean, it's, at the same time, we do understand everyone's frustrated. There's no question about that, whether you're frustrated because you can't get together. I mean, there's any number of things going on. But I think for us, we still believe that some of the social distancing is going to matter. And again, it's personal responsibility that's going to help carry us through this.
People doing the right thing. I appreciate that. So is there anything else? I appreciate your time. Is there anything else that you want to let our audience know in terms of where IRMC is in this pandemic, or any other sort of closing words that you want to let folks know?
No, I just want to say thanks. We're happy to come on anytime, and you know, it's important to share and educate. I think that there's you know, there's a lot of fear out there, and we completely get that. And I think that that's going to be important as we do move toward trying to schedule electives with folks, or even procedures that, you know, you may be on the fence about. You know, I think it's just it's really important for folks to know that the hospital is probably the safest place that you can be, because we do have the professionals, we have the equipment, you know, we have the processes, we have the experts that understand, you know, how to take care of folks, and whether it's COVID-19 or H1N1 or SARS or MERS, or, you know, we've been down this kind of, not the exact same thing, but we've kind of been down this path before, and so you know, we believe that you know, we're going to be around, and we're going to get through this to provide great care for the community, no matter what.
Okay. Well, thank you so much, Mark Richards, IRMC's Chief Growth Officer. Thanks for coming. Will you come back again?
Anytime, Gerald. I appreciate it. Thank you very much.
Okay, great. Thank you very much.